Mental health relapses can happen. A relapse is when troubling symptoms of a mental health difficulty come back or get worse. You can learn efficient ways to monitor your well-being and take action when needed, much like recovering from a physical injury. Relapse can sometimes be unavoidable, but early intervention can reduce how severe it is. There are lots of steps you can take to help prevent or lower the risk of relapse. The principle of self-management means you take charge of your health. It is about building small, practical steps into your day to help you recognise early warning signs, to create plans to support you in difficult situations, and to care for yourself. Together, these can help you to prevent a relapse or lessen the effect of symptoms on your daily life. Take medication as prescribed. Engage in aftercare and support groups. Identify your warning signs. Take action. Have a relapse plan. Seek outside help when needed. If you take medication, it is important to follow your doctor or care team's recommendations, even if you feel well. In fact, especially if you feel well. You may need to continue medication for several months or longer, depending on your risk factors. Stopping medication too early or not taking it as prescribed are major reasons for relapse. So it's crucial to talk with your doctor or care team if you want to change your medication plan. It is important to engage with aftercare if it is recommended or part of your care plan. Aftercare might, for example, mean attending a group session or therapy appointment on a regular basis. Many programs or services here in St. Patrick's Mental Health Services offer aftercare. Aftercare is very beneficial to your long-term recovery, as it can give you an opportunity to explore, prepare for, and address the barriers or challenges you might face. Support groups can also be very helpful, bringing together people with common experiences or challenges so that they can provide support, empathy, and reassurance to one another. An early warning sign is a signal that shows your health may be getting worse before major symptoms begin to highly affect your life. The purpose of identifying your unique warning signs is to help you take action early. Think back on times when your symptoms were extremely difficult. How did they start? How did they progress? What did you experience? What kind of thoughts did you have? Did your behaviour change? Did anything happen in a particular order? After you've identified your warning signs, think about what was happening in your life when you started noticing these changes. This will help you see when and where your warning signs start happening. These situations are called triggers. While everyone has their own triggers, some are common. For example, sleep problems, grief, conflict among loved ones, at work, or within a social circle, an unpleasant event, overuse of alcohol and other drugs, not following your care plan, other stressful events, other health problems or concerns, be they for yourself or for others. Now it's time to put everything together. Think back to your last episode. Can you tie your warning signs to any particular triggers? If you can, try to map out a timeline showing your triggers and warning signs in order. It's helpful to think of this exercise as an opportunity to take control of your mental health. When you identify your early warning signs, you give yourself the power to change and challenge the outcome. Taking action around your physical and mental health can give you perspective, resilience, and a sense of control. This can help you to stay well and reduce the risk of relapse. There are a few key ways you can take action. Build healthy coping skills, follow a healthy lifestyle, and taking part in healthy activities can help you build your coping skills by impacting your mood and strengthening your ability to tackle challenges. Unhealthy activities, on the other hand, can worsen mood problems and reduce your ability to cope. Therefore, you need to eat well, Exercise regularly. Exercise has many positive benefits for mental health. Start with manageable, realistic goals and gradually increase them as you gain confidence. Get enough sleep. Sleep is very important for mental health. Watch your sleep patterns, particularly when traveling, taking holidays, or working long hours. Try to go to bed at the same time each night and get up at the same time each morning. Build your knowledge. Become an expert on your own mental health. Ask your team about your symptoms and treatment. Take part in groups or programs that are diagnosis specific. Practice relaxation. Find an activity that you enjoy and set aside time to practice it. Grow your healthy thinking skills. Mental health difficulties can really affect the way you think about yourself, others, and the world around you. Part of healthy coping involves identifying and challenging thinking problems. Managing stress is a big part of staying well. You can control some stressful situations, but it's unlikely you can get rid of all stress from your life. Therefore, establishing what causes you stress and taking action to solve it reduces the effects on your well-being much more quickly. When you have identified your signs of stress and situations that may cause problems, it's time to plan how to manage them. Think of the toolbox of supports that will help you with this. Start slowly. If possible, add potential new stressors gradually. Practice self-care. Remember, self-care is even more important when you are dealing with a stressful situation. Cut back on ongoing responsibilities. Check in with yourself about what responsibilities are absolutely essential. It's okay to focus on these and let people know that you need to spend time on other things. Make sure your own expectations are realistic. If you take on something new, it's okay to cut back on something else. Applying problem-solving skills is useful when you're facing a challenging situation. There are 6 key steps to apply. Define the stress or stressful situation. Figure out what the stress is and how it's causing problems. Set goals. Decide what you want your solution to address with realistic goals. Think of solutions. Consider the support of family, friends, and if needed, treatment services that are available. Look at pros and cons. Pick a few possible solutions and consider their positives and negatives. Pick one solution. Remember, the solution should describe who does what and what you want to achieve. Evaluate the results. After you put your plan into action, see if it worked, or if some of it worked, and what might need to change. You can plan ahead for times you need extra help. The best time to do this is when you're feeling well. Whatever way you structure your relapse plan, it should outline what should happen if you or members of your support network notice warning signs and what each person should do. Your plan might include signs that you aren't feeling well, information on when you want outside help, where to go for that help, or who to contact in an emergency, your preferred treatment options, a list of your current medication and any known allergies, contact information for St. Patrick's and your admission number if you know it, contact details for any family, friends or others you would like to notify if you need to go to hospital. Your action plan may also include practical steps for others to do if you need to spend time in hospital. Involving family, friends and supporters in your relapse plan can also help you make decisions and allows them to contact other supports and services if needed. Our recovery program, which is a day service, gives you the opportunity to develop your own personalised wellness recovery action plan. This can help you and those who support you to identify your wellness tools and monitor how you are. This will help prevent relapse and also sets out the steps to take if you do experience a relapse. Asking for help when it's needed is a sign that you understand how your mental health affects you and how you want to take action. Contacting your care team is a good first step. You can contact our support and information service by calling 01 249 3333 or emailing info@stpatricks.ie. We are here to advise you of your best options and to give assurance. The support and information service runs from 9 a.m. to 5 p.m. on weekdays, excluding bank holidays. If you are in crisis and need urgent support, please call the emergency services on 999 or 112. If you are at immediate risk of harm, you can go to the emergency department of your nearest hospital. While there, you can be seen by a team who will assess you and help you through the crisis. Our on-site information centre and the library in our online patient platform, Your Portal, provide more useful resources. You can also visit our website, stpatricks.ie, for more information.